And of course, if we step back and think, well, what determines health? Why could this be? We have to look back at decades of unequivocal evidence about what drives and prevents early death. And in fact, genetics is maybe 20% of that piece of avoiding premature death. And healthcare is thought to be about 20% also. But the big bucket of things, as so many of you in the audience know, are really the social, environmental, and behavioral factors, of which people estimate, depending on the illness, 60–70% of the contributing factor is really this red bucket. Well, what's in the red bucket, that is, things that are being spent, services being financed that might deal with social and environmental and behavioral determinants, are things like employment programs, job training, supportive housing, rent subsidies, all kinds of nutritional programs, WIC, all the way up to Meals on Wheels for older adults, family assistance, and a whole host of social services that exclude health care, that exclude the benefits for health. And instead of quantifying what are we spending on health care, why don't we quantify what we're spending on the entire encompassing group of that, both the health and the social services, and call it the total investment in health? And what if we look at that compared to all the other countries? Where are we? So this is a chart laid out the same way, but the blue bars are our percent of GDP spent on healthcare services, and the red bars are the percent of GDP spent on all those other social services that don't include healthcare. And we can see the United States is not a big spender anymore. We're just kind of in the middle. We're not anything very special